Hello, my name is Lainey, and today we are going to talk about the lungs, how the lungs work, and a very common abnormal lung condition called asthma. So here we have our model of our lungs. Now this bottle is going to represent the thoracic cage. Inside the thoracic cage, we will have the heart, the lungs, the aorta, and the esophagus. The thoracic cage is also protected by 24 ribs. You'll have 12 ribs on either side, and the sternum to make sure that nothing penetrates that area and it can work properly. In our particular model, these two straws here is going to represent our esophagus, and down here the two balloons, the blue and the yellow, are representing our lungs. This bottom balloon here represents the diaphragm, and the diaphragm is our muscle that is responsible for lung expansion and breath control. So what we have here is if an individual intakes air and inhales, the diaphragm expands and it'll fill up the lungs. When the individual exhales, the air goes out through the esophagus, exits into the atmosphere, and then the lungs will, not deflate, but the lungs deflate. So we've got inhalation, okay, and it inflates the lungs, and then exhalation. Inhale and exhale. Lung capacity represents the volume of air in the lungs upon maximum effort of inspiration. And a healthy individual will have a total lung capacity of 6 liters. However, there are several factors that will determine how much a person can inhale and hold within their lungs at a particular time. So some of those factors will include age. Those who are younger and more vibrant will have a greater lung capacity than someone who's older or had a few years on them. Gender, men tend to have a greater lung capacity than females. Body composition actually plays a part. So individuals who are taller will have a greater lung capacity than those who have a shorter stature. And individuals with a high waist to hip ratio will have a lower lung capacity as well. Physical activity will determine those who are more physically active, who are used to bringing in a lot of air, tend to have a larger lung capacity. And chest wall deformities will also play a part, as well as respiratory disease can also play a part. So gas exchange will occur inside the lungs. As an individual inhales, they take in all of the air that is filled with that wonderful oxygen that our tissues need in order to survive. It exchanges in the lungs oxygen for carbon dioxide, and upon an exhale, all of that air filled with carbon dioxide goes out through the esophagus and into the air. Some people, however, when they bring in that oxygen, also bring in a substance from the environment that their particular body doesn't like, and that's called an allergen. And when that happens, the body has an immune response. It will tighten and constrict those vessels that's bringing in that air. So, and it becomes inflamed. So that inflammation causes a constriction, and that then causes the air to back up and create an airway obstruction. When that happens, a person will begin to hyperventilate. They're trying to get air into their system, but they can't because that obstruction. The vessels are so tight, they're not getting enough air in, which is causing that backup. What a patient or a person experiencing an acute attack of asthma will start to wheeze, they may cough, They'll feel a shortness of breath. They'll feel a tightening. Clinical manifestations that someone will experience is their respiratory rate will be above 30 breaths per minute as they're trying to get air in. Their heart is going to beat faster, above 120 beats per minute, to try and move that oxygen through that obstruction. All of their accessory muscles in the chest, the necks will start to expand and get bigger, trying to get that air in through the obstruction. A patient who is experiencing hypoxemia from the obstruction will become more irritable. Auscultations will hear wheezing. Upon percussion of the lungs, we will indicate hyperresonance. And as the episode begins to resolve, the patient will produce a thick, stringy mucus. Any emergent situations are diminished or absent breath sounds that indicate a significant decrease in air movement, which results from exhaustion. Severely diminished breath sounds are called silent chest. So what you'll see is someone wheezing, grasping for air. And if they can no longer grasp for air, they're still trying. Physically, you can see them trying, but now they're not making any sound. That is an emergent situation, and that is in a situation where we've got a severe obstruction, and we're going to need mechanical ventilation to help. Asthma can affect all people of all ages, but we're typically going to see it occur in young children, and it is a condition that cannot be cured, but it is a condition that can be managed. Important nursing interventions for someone who's having an acute asthma attack is to supply them supplemental oxygen. They're having an obstructive airway. They're not getting enough oxygen in to feed their tissues, to feed their body. Without that, all of their systems will start to shut down. So we are going to need to provide them with additional oxygen support that their bodies currently cannot do on their own. In addition, we're wanting to monitor their pulse oximetry, see how much oxygen is inside their blood through a continuous pulse oximetry. We don't want to take that off. We want to know what's happening at all times. We want to make sure that the partial pressure of oxygen is at least 60 millimeters of mercury, or the O2 saturation is greater than 90%. So anything lower than that, they're definitely going to need that continuous pulse oximetry and that supplemental oxygen. Medication treatments may include an inhalation of short-acting beta-adrenergic agonists, often referred to as a SABA, such as an albuterol inhaler. For severe exasperations, they're going to want inhaled ipratropium, such as Atrovent, and sometimes that's used in conjunction with a short-acting beta-adrenergic agonist. And corticosteroids are often used for patients who do not initially respond to the SABA alone. In addition, a nurse is going to want to monitor the ABGs, the arterial blood gases, to see what that perfusion is, how much oxygen is actually getting into the bloodstream, and how much carbon dioxide is actually getting out of the bloodstream. As I mentioned earlier, asthma is a condition that cannot be cured, but it is a condition that can be managed. So a nurse is going to want to provide some education to their patients to let them know how they can manage their symptoms. The first things that they're going to want to explain and encourage is to encourage them maintaining a healthy weight, eating a heart-healthy diet, and getting regular physical activity. Managing stress will help them with acute attacks. To educate them on breathing techniques, relaxation techniques, and ways that can help them control their symptoms when they're feeling an attack come on or when they're starting to feel triggered. If a patient is smoking, that is something that already decreases the airway and keeps oxygen exchange from happening. So encourage them to quit smoking or to stay away from others that do. Secondhand smoke can also do just as much damage and can trigger just as much as smoking itself. And then, of course, to try to get good, solid, healthy sleep each night. Managing their asthma attacks at home would be to start to understand what their triggers are. What is triggering their attacks? You may want to encourage them to keep a diary. Whenever they're starting to feel an attack, what is it that they were doing at the time? What did they eat? What was in the area? So that they can start to recognize what is triggering their bodies into creating this inflammation so that they could stay away from it in the future. They're going to want to learn how to monitor asthma using a peak flow meter, which can help warn them of an attack coming on prior to them even experiencing any symptoms. So educating them on what a peak flow meter is and how a peak flow meter works, receiving a demonstration back can really help a patient monitor and manage their own asthma at home. Pursed lip breathing before, during, and after an activity that causes shortness of breath. You're going to want to demonstrate for them what pursed lip breathing is, as well as receive a demonstration of that pursed lip breathing back. And finally, medication management is something that a nurse definitely wants to communicate and educate their patient. Most medications for asthma comes in an inhaler form, and when they're starting to feel an acute attack coming on, they can take in a breath of this inhaler or inhale the medicine that will release the constriction of their vessels, thereby allowing the air to flow through, no longer have an obstruction that's creating the issues. However, inhalers need to be utilized in a particular way. So it is important for the nurse to demonstrate how to use the inhaler and then receive that demonstration back from the patient so that we know that proper education has been established. Asthma can be life-threatening if it is not managed appropriately, and that can be a scary thing for any person, especially a child who is just now getting a diagnosis of asthma. Therefore, the nurse needs to offer community resources to the family as well as the patient to let them know that they're not alone, and if there is any questions or any issues that come up, that they can go to them. In Arizona alone, we have the Arizona Asthma Coalition. The Arizona Department of Health Services can be a great resource for the patient. American Lung Association of Arizona can be of great service. For people who are smoking that need help with smoking cessation, there's the ASH line. Banner Children's has an asthma support group where any age or child or teenager with asthma can come with their parents. They meet about 4 times per year and they have fun activities. They do activities like roller skating, they go to the zoo, they go to jump zones. They provide education to allow those families to realize that this isn't a restrictive condition. They can still have all the fun as a child that they want to have. There's a breathmobile at Phoenix Children's Hospital that is a self-contained mobile asthma clinic. They provide screening, diagnosis, treatment, asthma education, self-management for low-income individuals, uninsured children, and they service 22 schools in the Phoenix metropolitan area. Camp Soaring Eagle is a free asthma respiratory camp, and they provide activities including horseback riding, fishing, arts and crafts, and archery. And then there's the Asthma Allergy and Immunology program, where people can learn about their symptoms. They can learn about diagnosis and treatments. There are a lot of resources available for people who have just been diagnosed and who are managing their asthma symptoms. So the nurse really needs to offer these resources to the patient so that they don't feel alone and they can learn to manage their life with their symptoms.